Ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to the WAFID Program Forum 2025. I am Ghadir al-Shahri, and it's my great pleasure to be with you here today. We are honored and delighted to have you all with us here at this forum, which brings together a distinguished group of specialists and stakeholders representing more than 860 healthcare facilities across 31 countries worldwide. This gathering aimed to enhance positive communication, review the latest updates and development related to WAFID program, and expand avenues in collaboration in a way that elevates programs system and achieve the highest standards of safety and health security. Distinguished guests, to begin the program, I will leave you right now with a brief introductory video about the Gulf Health Council.
Established in 1976, the Gulf Health Council marked a pivotal step in strengthening health cooperation and coordination among GCC countries across preventive, therapeutic, and awareness-focused fields. Since then, the Council has worked to unify efforts and align regional health policies and plans, supporting a more aware, healthier, and sustainable Gulf community guided by a clear vision. The Council continues to serve as a distinguished Gulf institution with regional and global relevance, contributing to the advancement of joint Gulf health efforts and to sustainable health for future generations. We carry a clear mission: to elevate the health sector across member states through constructive initiatives, effective responses to emerging health challenges, and support for evidence-based decision-making and policy development. To advance this mission, our strategy is centered on 4 principal pillars: prevention, awareness, development, and health support. These pillars are reflected in a set of leading programs and initiatives. Under prevention, the Gulf Center for Disease Prevention and Control, established in 2021, supports the monitoring and management of infectious and non-communicable diseases, alongside the WAFID Program, introduced in 1995 to ensure the health and readiness of incoming workers. In awareness, the Salamatak program, launched in 1980, continues to provide reliable health education, while the 2023 Your Health Guide platform enriches Arabic health content and broadens access to trusted information. In development and health support, the TAR-1 program assists member states through unified Gulf procurement and the central registration system, ensuring high-quality, safe, and effective medical products. In 2023, the Nashwatak digital platform was also introduced, providing accessible electronic pharmaceutical information. In partnership with the Ministries of Health across member states, the Gulf Health Council continues its journey to deepen regional cooperation and advance sustainable health. Gulf Health Council, together toward a sustainable, healthier future.
Ladies and gentlemen, and now we will hear a few words from His Excellency, the General Manager of the Gulf Health Council, Mr. Sulaiman Al-Dakhil, to officially open this forum.
In the name of Allah, the most compassionate, blessed Prophet Muhammad, companions, dear participants, I'm pleased to launch the first edition of the WAFID program. It is a great honor to meet here today with our partners in success from GCC countries and representatives of the health facilities, accredited health facilities. We are here today to engage in constructive dialogue focused on protecting Gulf communities and ensuring a safer, healthier future for all expatriates arriving in the GCC countries. Distinguished guests, the GCC Health Council represents a cornerstone of joint Gulf cooperation since its establishment. The Council has worked to support healthcare system across the GCC, strengthen preventive measures, and improve quality of life. The Council places the health and safety of expatriates a top priority, emerging from its belief that the health of the expatriates and visitors is inseparable part of the health community, health in general. It is in direct investment in development and economic and sustainable productivity. Emerging from this understanding, program is one of the most important initiatives of the GCC. It is a unified platform to ensure the fitness of the expatriates before arriving to GCC, working under unified standards to ensure safety and the quality of and checkup. It is in line with our vision to communicate with the health facilities, accredited health facilities in Wafid. Within the recent developments in the program measures and regulations, we are pleased to organize this forum, which will continue to be organized regularly and in contact with our partners. Our goal today is to deepen the understanding of these recent updates and to open direct, constructive dialogue on the program's regulatory, technical, and operational aspects. We aim to address the most common questions and clarify the dimensions of our joint work. In conclusion, I extend my sincere gratitude to our partners from the GCC countries and the accredited medical institutions and all those who contributed to organizing this event. We ask Allah Almighty to grant us success to make the outcomes of this forum a valuable addition to the WAFID program and to the shared Gulf health system. Peace and blessings be upon you.
Years, WAFID program has achieved remarkable progress in unifying standards and facilitating the arrival of spectators to accredited healthcare facilities. It has been possible through expanding the geographical coverage of the program. And now we will present to you an introductory video of the WAFID program. This video showcases the program's history and achievement, explain the process for the medical center submission and accreditation, and also illustrate the complete journey for expatriates from start to finish.
At the heart of a unified Gulf organization that leads with innovation and collaboration, WAFID program stands as a vital pillar under the Gulf Health Council, dedicated to safeguarding the health and safety of all the expatriates traveling to GCC nations. Since 1995, WAFID has built a trusted framework that unifies standards for accrediting and evaluating medical centers in the origin countries of the expatriates, ensuring that every examination is accurate, reliable, and meets the highest level of quality. A commitment that strengthened regional and international cooperation and earned the official endorsement of the Supreme Council in December 2016, marking WAFID as a cornerstone of the region's collective health security. We carry a noble mission, one that drives us to uphold the highest standards of quality, trust, and coordination across the Gulf region. Through unified accreditation procedures, WAFID program ensures that every medical center in the origin countries of the expatriates meets excellence, delivering precise, reliable, and credible medical examinations before expatriates arrive in the GCC. With continuous evaluation and a fully integrated digital system, we strengthen cooperation among GCC member states, enhance data exchange, and raise the efficiency of accredited facilities through training and development, advancing public health and security, and prevent the spread of disease. WAFID electronic portal connects every accredited medical center within a unified digital network, a gateway that links expatriates, embassies, and visa-issuing authorities, ministries of health across GCC member states. Together, they form an integrated health system, ensuring accuracy, transparency, and real-time coordination across borders. WAFID program serves as a digital bridge connecting expatriates, accredited medical centers, and government entities. From the moment an appointment is booked online to the completion of medical examinations, every step is securely managed within one unified system. Accredited centers play a vital role, conducting required tests, issuing results through standardized electronic medical reports, and transmitting them instantly to the concerned authorities for visa issuance across GCC countries. Through this seamless process, WAFID ensures accuracy, transparency, and efficiency at every stage of the journey. Joining WAFID program means becoming part of a continuous journey of success. Since 1995, WAFID has expanded geographic umbrella to cover 31 countries with more 850 accredited medical centers, delivering trusted, high-quality medical services to over 5 million applicants each year. The process begins with the submission of an accreditation application by the medical centre. Each application is reviewed and evaluated, followed by the scheduling of a technical visit. A specialised technical committee will be delegated to conduct on-site assessments, ensuring full compliance with WAFID standards. After evaluation, the accreditation decision is issued and WAFID Program will issue an electronic users for the accredited centres on WAFID systems, marking the final step in establishing a trusted, accredited medical partner within the WAFID network.
WAFID program has recently introduced significant enhancement in its regulations and guidelines designed to strengthen the quality standards, improve procedural efficiency, and also refine operational mechanism in alignment with the best practices. These updates were informed by specialized studies, periodical review, and central committee's commitment to evaluating and elevating the overall performance of this program. And now we will start our first panel discussion, which will address the key updates of WAFID program guideline and regulations with participation of distinguished members from the Central Committee representing the member state. I would like to welcome the doctors who are with me here today to talk more about these regulations and guidelines. I would like to welcome Dr. Safiya Shamsi from the United Arab Emirates, Dr. Halima Srehi from the Kingdom of Saudi Arabia, and Dr. Fatma Al-Hakamiya, Sultanate of Oman. Welcome to the first panel discussion of today's forum, doctors. It's a pleasure having you here today to talk more about the updates and the regulations and guidelines of the WAFID program. First of all, we would like to start with you, Dr. Safiya, to know more about the basics and the more important thing about WAFID program. Starting with, what is the nature of work to the medical facilities accredited under the WAFID program?
Actually, these medical facilities, which located in expatriate sending countries, are authorized to conduct or perform the medical screening. They are assessed and accredited under WAFID program in accordance with the rules and regulations which approved by GCC Ministers of Health.
And if we want to know about what is the official procedure to obtain the WAFID program accreditation?
The accreditation is obtained only through WAFID electronic system, where the medical facilities will submit their applications, which will be reviewed by a specialized team. So if they will meet their requirement are met, preliminary approval will be issued, and the facility will be scheduled for the technical or next technical visit to the country.
Okay, and talking about that, doctor, I would love to know, so there will be a status for each application that the participant can already see? So they be aware where are they standing in each phase, let's say?
Yeah, the first step will depend on the facility if they will submit their documents fully submission. And then the decision will be taken by the WAFID program team for the next visit. Either the visit will be after 1 month or 6 months. It depends on the schedule, which is prepared annually.
And about technicality, how are technical visit dates determined?
WAFID technical visits are conducted annually for all participating countries, and for the new countries, which if they have pending accreditation request. Each year, the schedule is approved in December of the prior year.
And moving on to how are medical facilities evaluated and accredited after the annual technical visit schedule is completely approved?
The council appoints technical committees to conduct the visit. The evaluation are carried out by experts nominated by GCC Ministries of Health. The process of evaluation and accreditation is fully electronic, including live documentation, photo documentation. And after reviewing the final evaluation by the Central GCC Committee, the decision will be taken for the accreditation, and will be in line with the program rules and regulations.
Dr. Safia, if we may ask, is there, I would say, a time frame for the participant to think about?
We cannot say, because it depends on our requirements. Maybe we need, it depends on the scheduled visit and depends on our requirement in this country or this city.
Yeah, so
if we need to add more centers.
Okay, I see. And last but not least, we'd like to know from you regarding the regulations and policies. Is there a periodic review of these regulations, and what improvements is the program aiming to achieve in relation to facility accreditation?
Yes, the program is periodically updates its regulation to meet the operational needs. The last framework or last version approved by GCC Ministers of Health on October 2025. And it will be effective by January 2026. Maybe this time the most notable update in the system, that introduction of a fixed accreditation period of 3 years for the centers, after which all the centers will be re-evaluated to renew their accreditation. This is a new rules for the WAFID program.
So from now on, as you say, starting from January of 2026, the period of the permit, we may say, is for 3 years. Yeah, and after that, it's not going to renew by itself. It needs to be re-evaluated.
Re-evaluation.
Yes.
To renew the accreditation.
Yes, but it's not going to be as the same procedures as they did the first time.
No, almost the same.
Almost the same.
Because the same standard, same requirement.
It is, indeed. Thank you so much, Dr. Safia. It was a pleasure talking to you and know more about the WAFID program. And we'll move on with Dr. Halima Srehi. Welcome, Dr. Halima. Would like to know from you, do the regulations updates include changes to medical unfitness cases or required medical examination?
Thank you for the questions. Yes, absolutely. WAFID program maintain an ongoing update to its regulations to ensure it's aligned with international health standards. These updates are usually done through a specialized committee, and even specific when it's related to the medical examination tests. It's run through a scientific committee in collaboration with the Gulf Center for Disease Prevention and Control. And currently, the recent updates, it include an update for unfitness, for medical unfitness condition, whether it's a communicable diseases condition or non-communicable diseases. For communicable diseases condition, it include HIV positive test, hepatitis B surface antigen positive, hepatitis C antibody positive, microfilaria, leprosy, as well as active TB, and also any abnormality in X-ray that is suggestive of TB, such as cavitation, miliary TB, Heller lymphadenopathy, apical changes or fibrosis, and some nodular changes that, as I mentioned, it's suggestive of TB. Also for the non-communicable diseases, which include diabetes, hypertension, cancer diseases, some mental health disorder, as well as heart failure, liver failure, and renal failure.
Relating to your answer, doctor, I'd love to know from you, and that, of course, is a very important thing that a lot of people might be thinking about, is there a list of required tests to diagnose these conditions that you just mentioned?
Yes, definitely. The detailed test for the required, or let's say the required test for each specific medical unfitness condition are detailed in the medical examination appendix of expatriate, which all accredited medical center they have to follow and go through it.
Yes, it's a very important update, and it's really actually interesting to show how the WAFID program is really putting great regulation, very straightforward, with all the details needed to make sure that everyone is safe. It's all about safety. And this is something we should all be proud of, that it's actually happening within WAFID program. Thank you so much, Dr. Halima. It's great to talk to you. Moving on to Dr. Fatma Al-Hakamiya. Welcome to this panel discussion, Doctor.
Thank you.
First of all, I would like to know from you, given the strong governance of medical screening for spectators before their arrival in GCC countries, are there any procedure taken upon their arrival to verify their medical fitness?
Certainly, in all ministries of health and authorized authorities, they will repeat the test once the expatriate arrive into the country. This is to validate the medical fitness certificate.
Yes.
And once we repeat the test, if we diagnose the diseases listed by my colleague, penalties it will be issued to those medical facilities. In each GCC country, they do report the cases of unfit test, which was reported in their country. WAFID program, it will automatically list those centers. Okay. Once they list those centers, it depends on the time frame where those tests was done in the origin country, comparing to the date which was done in the GCC. Let's say if it was done within the time frame between the origin and the time date in the GCC, penalties and sanction will be applied to those centers. And this procedures, it will make sure that all candidates who will enter GCC, they will have two types of filtration. The first filtration, it will be in the origin country, and the second filtration, it will be in the GCC country, and this will ensure the health security in the GCC.
That's so true. And as we just were talking, this program is all about taking care of the citizens and spectators at the same time. It's not only looking for a group of people. It's actually serving and helping everybody, whoever coming and whoever living here.
Definitely.
So it's great that we see how strict the policies are to ensure, as you just mentioned, the health security for everybody. And talking about penalties, Doctor, are there any actions taken against the medical facilities during the technical evaluation process?
As my colleague, Dr. Safiya, mentioned, that each year we do visit those centers. And we visit them to make sure that they are aligned with the regulation of WAFID. And during the visit, if we noticed or if we reported any violation of the regulation, the penalties, it will be ranged, or it will be leveled, okay, from only directing the medical facilities to warning to until penalties reaching stopping the medical facilities from performing their medical fitness. And the most I can say the highest level of penalties is removing that center from WAFID program.
Yeah, so WAFID program not going to be working with that medical center at all?
No, it will. Their license, it will be removed.
Okay, but this doesn't happen like as a, let's say, a first-time penalty.
No.
It depends on how many
violations
they had.
It is leveling the type of violation, how big it is, how it will impact, as I said, the health security in the GCC.
Yes.
According to it, we level it, and the penalties will be issued to them.
We can say that each case has its own scenario.
Yes, exactly. Yeah.
Thank you so much, Dr. Fatma, Dr. Safiya, and Dr. Halima for being here with us today and for sharing these new updates and guidelines for WAFID program. It was great having you here,
The pleasure
doctors.
is ours. Thank you very much.
And with this, ladies and gentlemen, we conclude the first panel discussion, and we will take a very brief break for 5 minutes, and then we're going to come back to the second panel of the day, which is actually Q&A that we have received from you earlier and was submitted by the medical centers. So when we come back, we'll dive deep and get to know more about these Q and have the right people to answer them.
Test, test.
Test. Okay.
Test. Test.
Testing. Welcome back, honorable guests. Now we begin the Q&A session, which we will address all the questions that was submitted by the medical centers prior to this forum. Joining us for this session are the esteemed members of the Central Committee, along with the Director of WAFID Program, who will provide their insights and clarifications regarding your questions. We look forward to have an engaging and informative session. I would like to welcome my esteemed guest for this Q&A session, Dr. Sami Al-Nasr from Kuwait, Dr. Ibrahim Al-Sha'ar from Qatar, Dr. Wafa Al-Judar from Kingdom of Bahrain, and Mr. Abdullah Al-Angari, Kingdom of Saudi Arabia. Welcome to this discussion, and I'm pretty sure that a lot of people who are watching right now are really interested in this session specifically, as we will address the main concerns that was submitted by most of the medical centers. So starting with Mr. Abdullah, we would like to know from you. We received actually several inquiries regarding the system integration. Could you explain how the WAFI system is connected with the GCC authorities and how this integration supports the overall process?
Sure. Thank you very much. This is actually an important question, as the system integration plays a major role in the WAFID program. Actually, the system integration is the core strength of WAFID program, as it enables for an accurate and fast processing of the data and the medical report. WAFID program is integrated with visa issuing authorities across the GCC countries. This allows for an automatic verification of the medical reports, which will minimize the errors. and in return, or this process, it will reduce the manual process of the medical center. Also, as I mentioned, it will minimize the human error, and of course, it will speed up the process of the applicant's journey overall. Of course, we continue to enhance and expand those integration to meet or to improve our efficiency and to meet the future requirement of the program.
Also, we received, Mr. Abdullah, several inquiries seeking more clarity about how the equal distribution mechanism works. Could you actually elaborate on the process and how it ensures quality between medical centers?
Sure. So let me just give a short brief about the equal distribution process and how it works.
Yes.
Exactly. So the system is designed to receive the application appointments, collect them, then equally distribute them between the accredited medical center in the chosen city of the applicants.
Yes.
This process will ensure that there is no overload in some certain centers, while the other centers on the same city are underutilized. Which, of course, will improve the efficiency of the medical centers. It will reduce the waiting time of the applicants in the medical centers. And most importantly, it will increase the quality of the testing in the medical centers. We continue to closely monitor the system behavior, and we are making the enhancement as we go through the time to meet our medical centers and the expatriates' needs.
So, Mr. Abdullah, by what you just mentioned right now, that means that the committee, or let's say, the Wafid program committee will choose, or let's say distribute the medical centers not in a random way. So basically each medical center will have their own applications. So as you just mentioned, it's not going to be one overused medical center than the other. So it's not upon the participant choose. It's actually through Wafid committee who will align and see which medical center they want to give the application to.
True. Just to be clear, it's a fully automated system.
Okay.
So the system will automatically distribute those medical appointments through all the accredited medical centers.
Yes, I see. Thank you so much, Mr. Abdullah. Moving on to you, Dr. Wafa, I would like to know from you, how can candidate data be modified in medical reports?
The candidate and the expat can modify their medical report, but they have to go first to the center who conduct the medical examination. And through the medical center, they will contact Wafid through the Wafid program electronically. They request what kind of changes. And after the revision from Wafid, the decision will be taken to be approved or not for these changes, and it will be automatically reflected on the Wafid system, the changes that has been required to be modified.
The best thing about this that it's all online.
Yes.
Let's say the company or the person himself, they can definitely see what's going on, submit whatever they need to submit, and it's all online. It's not like back in the days where people need to go themselves, everything was physical. So it's definitely a huge jump where it's going to accelerate the process in a very positive way. Dr. Ibrahim, would like to know from you, are there specific requirements for editing the results of the medical report?
First of all, I will have the opportunity to thank the Gulf Council for the arrangement of this event, which actually we are looking for it for a long time. And that shows the commitment of the Gulf Council to our partners in the different countries. So we are really happy to contact them online. Regarding your point, actually, this is a critical and important issue for us, the medical, the Gulf Council, for the centers and for the applicant. The change from fit to unfit and the other way around. Actually, for the fit to unfit cases, the requirements should be submitted within 24 hours from the releasing the result by the centers and the authorized person in the centers. This is very critical for us because we want to minimize, like, any errors, any playing around this area. This is for the fit to unfit cases. For the unfit to fit cases, they can do it even after 24 hours. It's not critical as the fit to unfit cases, which should be submitted within 24 hours by the authorized person from the centers to the Gulf Council, and then they will take the necessary actions for this.
Okay, Doctor, I want to ask you, maybe you know about this, or maybe also Mr. Abdullah, you can answer this. So let's say you said from the unfit to be fit, it needs to be within 24 hours submitting the cases.
No, actually, from fit
to unfit.
Within 24 hours. For the unfit to fit, it can be after 24 hours.
Okay. So if the medical center or the a person who's in charge for submitting these reports didn't do it within the certain time that it's there, will there be penalties for the medical center itself?
Actually, that will be back to the Gulf Council, and they will study the case by case.
Yes.
And then if there is a clear justification by the centers, they can solve the issue.
Yes, yes.
Actually, it's not the matter of penalties, it's a matter of easing everything for all parties.
Everybody.
Actually.
Yeah, very clear. Of course.
So when the medical center gives a fit report, this opens the candidates to go through the visa application process, and the visa might be issued.
Yes.
So once there is a mistake in the report and the visa is already issued, the expatriates will come to the GCC countries, and the second testing will happen, and it might be unfit. So the medical center might be penalized.
I would say that in the second stage of the report, which is going to be made here, and depending on the country, this is where you know if the first one was correct or not, and issue a penalty if needed. Very clear. Dr. Sami, would like to know from you how should medical centers handle cases diagnosed with unfit reasons and it is treatable diseases?
Okay, thank you. As the expatriates, we know some expatriates, they get unfit because untreatable disease. Many centers, they asking to repeat this test, but as we know, in Patriot system, and Wafid system, it should be the result ready within 3 days. And also we give him another opportunity. After 2 months, he can repeat the test. But not all the disease. There is some diseases should be requested from the Ministry of Health in some countries. After that, he can repeat after 2 months.
Very clear. Going back to you, Dr. Ibrahim, several inquiries have been received regarding the determination of medical fitness for certain conditions, such as, let's say, for example, the Tiana vesicular, if I'm Yes. So how is the medical fitness status determined for expatriates diagnosed?
Actually, we have what we call it the bylaw of the Gulf Council, and it's been updated and continuously updated and reviewed by the Central Committee and by the Gulf Council itself. And we have we review the communicable and non-communicable diseases, and there we have clear annex, and most of our partners are aware about this annex. However, if there is any unclarity or any issues that a case or something is not in this annex, they can contact the Gulf Council and even at level of the countries, and we clarify what's the case and if we consider it fit or unfit. But mostly the cases that considered by WAFID as unfit is clearly defined, and It's not mentioned only. It's mentioned and defined, and we have even
stressed
the limits.
on. Yes.
Yeah, very clear. It's very clear. But if there is any cases, new cases or different cases, they can contact the Gulf Council, and they will get the reply within a certain time, in short time.
Very interesting. And this is the most important thing, as I just mentioned, that many medical centers shared that, yeah, that might be a case that it's not clear at the website or at the right place where they can find the list. But thank you for clarifying that it's the most important things are just written there, and in case of any question or extras or special cases, they can definitely get in touch, and they will definitely get the answer.
And we have like helpline, like 24 hours as far as I know. They can send any queries within any time of the day.
Yes. Going back to you, Dr. Sami, we have been using the ELISA method for a long period of time. So would it be appropriate to progress to a more sensitive method such as CLIA based on higher sensitivity and speciality? We might say that higher specific and better detect early infections, let's say, sometimes eliminating the results with the ELISA.
CELIA is another method for immunoassay analysis, and it is a good test. Both of CELIA and ELISA, we are accepted. Now we can say if the center have ability to do CELIA, we are no problem with us. Both are good tests.
So yeah, medical centers can use either CELIA or ELISA, and it's not a big difference, we might say, as they thought it is.
No, CELIA, it's more specific than ELISA.
Okay, okay, good, interesting. Also, going back to you, Dr. Ibrahim, can we actually establish a center within a hospital with a shared license and machines? Let's say the center will always only do WAFID-related work.
Yeah, actually, this is a new direction for WAFID that we are accepting actually hospitals and any health authorities. As you mentioned, if the center or the management will locate specific algorithm or specific arrangement for doing the expatriate and with their result, with their examination, we didn't have any problem with this issue. Hospital sharing the same license, but specific area, specific arrangement for the expat testing, we don't have any issue with this. Especially with the new countries that we are, as you know, WAFID program is expanding in different continent, different area. We didn't have any issue with this. Mostly we are concentrating on the quality of the testing and the quality of the examination of the expat, actually.
So we would say if it meets the standards needed by WAFID, it's totally okay.
Exactly. This is the issue.
Dr. Wafa, is there a limit to the accreditation of health facilities, and on what basis are classifications added?
Actually, now in the WAFID system, they put an indicator to which city have more demand, so they can decide if we need more medical facility to conduct the medical examination. And also there is an update guidelines regarding the quota, how many center we need. There will be indicator about the demand. We see the number of the city, the number of the people in each city, and according to that, we the council will decide if we will need more centers in other cities. We need more center in the same city due to the high demand.
Yes, of course. So we can say that it's actually on the spot. Whenever the demand is high on a special city, probably, yes, the council will think of adding more medical centers as the community in this city needs more medical centers.
Actually, it's not on the spot. It's a regular follow-up. The council do a regular follow-up according to the demand of the expat medical checkup.
Yes, thank you so much, Dr. Wafa. Going back to you, Mr. Abdullah, we also received questions about feedback and suggestions. So how open is WAFID program to receiving input from stakeholders, and what is the official channel of submitting it?
Sure. Actually, the feedback and suggestions plays a major role on our ongoing development. We are definitely open to receive all the feedback and suggestions from medical centers. The official channel is info@wafid.com. This channel is dedicated on receiving the feedback and suggestions about anything that the medical centers might have a question on or want to suggest any thing. Actually, we rely heavily on the medical centers. They are their partners on the ground, and they face the issue that we might not see here in the office. So I would like to say that please do not hesitate to give us your feedback, and of course every feedback will be analyzed, evaluated, and work on. Just to reiterate what the esteemed guest were saying about about the fitness, fit and unfit cases. I'm sure a lot of centers might have questions on about the opening of the channels and new cities. You have info@wafid.com. You can share us your inquiry, and we will be replying to it.
So I believe you also answered the next question, which is who can be contacted in case of issues related to the Wafid system?
Definitely. This is another team that is dedicated as a customer service for the medical centers, for the Wafid also. This customer support team is operating 24/7, and the dedicated email for it, it's support@wafid.com.
So please.
A lot of things and changes in the Wafid program were based on our suggestions and queries and questions from whether the centers, our embassies, our health regulatory, the country's health regulatory. So it's like they are our partners, stakeholders, and they are sure involved in the development of the program.
That's very interesting. And yes, Dr. Ibrahim, it's as we see in this forum, this is what we talked about. We talked about the new regulations. We talked about the guidelines. We talked about what's going on and the most important changes that happened within Wafid within this year. And it's very clear it's all upon, or let's say most of them, upon the suggestions and questions and some, let's say, challenges that face the medical centers and stakeholders. So thank you so much. And as you heard, ladies and gentlemen, from Mr. Abdullah, it is very clear, info@wafid.com. This is the right place where you can definitely get in touch if you have any question, if you have any inquiry, and you feel that there is something it's not clear for you. They're definitely going to get back to you with the right answer dedicated to your special question. Thank you so much, doctors, and thank you, Mr. Abdullah. That was really informative session where we actually addressed most of the inquiries and questions that had been shared with us. Thanks a lot for being here today and for dedicating this time. Ladies and gentlemen, as we conclude this gathering, we extend our sincere appreciation for your presence, for your participant, and even if you were one of the people who asked questions, thank you so much, because with that question you actually made things clear for a lot of people also being part of this forum. And of course, your contribution to supporting this vision and objectives of this program. We hope this forum serves as a platform for new achievements and starting point for projects that will further strengthen our shared impact in the future, hopefully. And we are also pleased to inform you, once again, as Mr. Abdullah said, that you can definitely get in touch to us through the website. You can definitely visit the website and send an email at info@ wafid.com. I was with you, Ghadir al-Shahri, in this amazing forum, the Wafid Program Forum for 2025, and it was a great pleasure to be here. And of course, we are pleased to actually take this time and answer all the questions you had. Thank you so much for your dedication and the time dedication that you had. And of course, we look forward to see you in another event in the future. Assalamu alaikum wa rahmatullahi wa barakatuh.